Good afternoon. I'm going to go ahead and get started so we can have this presentation and get you on your way. Welcome to everybody to Putting Public Health Evidence into Action to Prevent and Control Cancer. This is a 6-part series. My name is Kama Scoffrey, and with Mary Wagon and Jennifer Lehman, we've been presenting on different modules in the series. And today it's my pleasure to present the last module of this series. And this module is evaluate and improve performance. Before we get started, I'd like to ask our CPCRN scholars to take attendance by just adding your name or in the chat for us. Thank you for doing that. So you may be very familiar if you attended our past trainings of the different modules that we had. We started off with understanding the problem or health issue that you're working with related to cancer prevention and control, establishing goals for improvement to kind of plan for the program, find and select evidence-based interventions. And then if you're not adopting the evidence-based intervention as is, we gave guidance for adapting evidence-based interventions. We talked about implementing evidence-based interventions. And today we're going to hit some highlights of evaluating for impact. These are the objectives of today's sessions. We're going to be able to differentiate between different types of evaluation, explain the differences between process and outcome evaluation and the questions that you might ask for both, help you identify measurable outcomes related to your aims, objectives, and activities, and also in using implementation science theories and models, and collect reliable and valid performance data. So we're going to start off with why evaluate. Of course, we often want to evaluate to share positive findings or results so that we understand implementation and we could share information with our program deliverers, funders, and decision makers, and other people who are engaged and enthusiastic about the program. We also share, particularly in disseminating our work so that others can learn about what we did, what are our processes, and of course, what was successful and what was not successful. Thirdly, we also evaluate to kind of do our either midterm or final assessment of where we might make changes and areas for improvements. And of course, we're able to celebrate things that are successful and share those, of course, with everybody that works with us on the project and the wider community. So there are different types of evaluation that you can do that we've actually discussed a little bit. How does PDSA cycles relate to evaluation? And so there was infusion of quality improvement in some of the different modules that we talked about. PDSA cycles are plan, do, study, and act, are basically smaller iterations where you're collecting data to kind of help you inform intervention. So you might be iterating on different components of an intervention or trying to make small changes. That is different from an overall evaluation where you are doing a full implementation of the intervention, understanding all the delivery processes, and trying to study outcomes over a period of time. So the first poll I have is, have you participated in an evaluation of an evidence-based intervention? Take a moment for the poll to load. So about 58% of you have participated in an evaluation of an evidence-based intervention. That's great. Hopefully you can share during the breakout some of your experience. And about 40% of you have not. So thank you for answering that question. It's always helpful to kind of get an understanding of where people are. So the next thing that we're going to talk about is the guiding framework for our presentation today, which is the CDC evaluation framework. Several of you may be familiar with this evaluation framework and the steps that you take typically in an evaluation. So it starts off at the very top center in engaging stakeholders, to describing the program, all the way to ensure that your evaluation data are used and that you actually share your successes and lessons learned. So we're going to take the whole training to kind of walk step by step through each of the different planning. In the middle of the evaluation framework are what are known as evaluation standards. The standards are utility, feasibility, propriety, and accuracy. And these are just guiding principles that we want to consider in any evaluation. So you want to be able to ask evaluation question and collect data that is most useful for all stakeholders involved. You want to make sure that you select evaluation approaches, for example, qualitative mixed methods that balance feasibility, maybe based on your resources and staffing, but it also ensures the best accuracy of or validity of your data. And then, of course, you want data that are based on evaluation methods that are legal and ethical and protect the welfare of all of the people engaged in the evaluation, which is the component of propriety. So we're going to start first with step one, which is engage stakeholders. So many of you know this, but I think it's always important to think about evaluation happens from the start of program planning and delivery. So we want to include people in that engagement who will directly benefit from the program. Also, potentially people who will oppose it so they can learn a little bit more about the program as it goes. Perhaps administrator who will make some decisions about the sustainability of the program or future program support. And of course, people who are delivering the program. All of these different stakeholders might have great suggestions for evaluation questions, their ideas about delivery and what they want to know. How you might involve each of the different stakeholders in all of these different categories, of course, will vary. So my next question is thinking about either an evidence-based intervention that you've been working with, and for those of you who have evaluated EBIs in the past, who might be some of the stakeholders that you've involved in an implementation evaluation. Please take a minute to type your response in the chat, and I can actually share some of those responses. Yes, very important. Karen said program participants. We often want to hear first and foremost from them to kind of get an idea of the program. Health systems partner, clinical leadership, in addition to community members. Community advisory board members, great. Many of you may have either advisory councils or boards, and either scientific boards too that might be giving you some thoughts. We'll take a few more. Executive leadership, another nod to administrators, and of course, people who deliver the interventions, great. And then we also have grant partners. Those are all great examples of stakeholders to involve. So the next thing you want to do is to be able to understand the program that you're evaluating. So this step is describe the program. One of the ways that we describe programs is not only just the program description that might be in the intervention manual, but is understanding the program from its mechanism. And we often call this the logic model or the theory of change. So these are all the components of the program that you have to have in place. So if you have health education materials as A, B is also educating clinical staff, and on. For each of these components, you're saying that these are necessary to be able to impact your outcome. So when you're developing your logic model of change, you want to make sure that your stakeholders understand all of the different components that go into the program delivery and also the outcomes. And logic models are one of the several evaluation formats that you might actually see, but they're very helpful in getting everybody on the same page. So we have some resources that were sent to you about logic models. One of them was developing a logic model. And there were also two other handouts, one on this fit-flu logic model so that you could actually have it in front of you. And then we also had other logic model examples. So I just wanted to call your attention to this. But logic models have three components before the outcomes, as you will see, which is where our end goals are. And first, we will start all the way to the left with inputs. Inputs are what are needed to lead to some of the outcomes. So the Fit-Flu program we talked about in a couple sessions. This is a program that tries to get people who are coming in for their flu vaccination, whether it's in a clinic or pharmacy, to also consider getting their colonoscopy through a fecal immunochemical tests or FIT tests. And so it's trying to do that double whammy of two preventative health measures at once. And so to be able to implement it, you see some examples of what you would need. You would actually need a champion. You would need the health system to identify patients who are due for screening because there's age eligibility. You would actually need the fit kits to be able to give to people who are eligible and on and on. Some of the different activities are to find the eligible patients, distribute the fit kit to them, do some education and provide them with materials. The patients need to complete the test at home and return the kits. The kits are tested for colon cancer, and then the results are communicated back to the patients. Outputs are actually observable deliverables from doing the activities that you have in your program. And you can see some examples here. So an output might be number and percentage of people who are actually flagged as eligible. And the second one, number and eligible proportion that receive the colonoscopy fit kits. And then you have your outcomes all the way to the right. And these are often designated from short-term to long-term outcomes. So for the flu fit program, the things that we want to change in the short term are patients' knowledge about colorectal cancer screening and their confidence to be able to do the fit kit through education and conversations with the provider. Our midterm objectives are getting the patients to be activated and to actually do the test and return the test. And of course, do follow up if people have complications or they need to be diagnosed, and of course, follow up with treatment. And the long-term effects of the Fit-Flu program is to reduce colorectal cancer deaths and morbidity, and also decrease colorectal cancer disparities. So this is one example of a logic model, and you could see in the activities, those are some of our activities based on our theory of change. So once you describe the program in narrative and also through the logic model, you want to focus your evaluation design. And this gets into the methods. And so in terms of focusing the evaluation, again, you want to think about what might be process evaluation measure and what might be outcome evaluation measure. So from the Fit-Flu logic model that I just showed, typically when you're conducting process evaluation, you might ask questions related to the inputs, the activities, or the outputs or some of the deliverables. Versus for outcome evaluation, you're much more focused on the short-term to long-term outcome. And typically in terms of our funding, we focus much more on the short-term and mid-term indicators there. So what are some examples of evaluation questions that you might have for process and outcome? So again, remember that process evaluation ask you to think about what goes into implementation and implementation monitoring or documenting. So some of those questions might be, are all of the activities in your program being implemented as planned? A nod to fidelity. Is the intervention feasible and acceptable? For those of you who are interested in both participant and also implementer attitudes and beliefs about the intervention. On the other side, outcome evaluation questions, as I said, measure short all the way to long-term impact. And so those types of evaluation questions are related to those areas of the logic model. Does your program lead to behavior change, knowledge increases, or changes in the attitude? Does it lead to changes in implementation of an environmental change in your clinic? When you're talking about the actual cancer outcome, do cancer screening rates improve because of our Fit Food program? Do we also have increased rates of diagnostic screening following positive FIT tests, and on and on? So these are some examples for you. So what guides our evaluation questions? Of course, we want to think about our aims in terms of what we say are the purpose and objectives of our program. And of course, these objectives are often the SMART objectives that we have on the right that have been written to be specific, measurable, attainable, relevant, and of course, being time bound so that you can actually check to see if it as a process indicator that your objective was met. You could also develop your logic models on the different components of your logic model. So your questions can be related to process and outcomes based on your inputs all the way to outcomes. You could also look at your implementation plan. Some of you might call it a work plan, and develop evaluation questions from those. One of the things that you want to do is look at your intervention developer's approach to evaluation. So if you remember, we talked about various sources of evidence-based programs or strategies, and it may be also helpful to refer back to what were some of the key evaluation questions that the original program had, so that you could also consider if you want to replicate some of those for your evaluation. And as we mentioned before, in engaging stakeholders as a first step, you would want to run and also ask your stakeholders, not only running by your evaluation questions that you have conceived, but do they have others that they want to add, or do they want to modify some of the questions that you have? So you want to engage them throughout the process. So we're going to take a little bit of time to just consider process and outcome evaluation and different time periods for outcome evaluation. So we're going to give you a moment to get into breakout groups and discuss what might be some evaluation questions that are process related, short and midterm outcome related, and also longer term evaluation questions for the Fit Food program that you might have. So I'm going to give you a minute to get into the different working groups. This was also one of the handouts that you received yesterday. So you can either write down on that handout or on a piece of paper that you have and kind of work within your group to maybe have at least one question in each of the 3 areas over the next 10 minutes. So Mary, thank you for putting them into breakout groups.
Okay, yep, I'm sending everyone off now. We'll do 4 different groups.
Welcome back, everyone. I think most folks have come back from the breakout rooms. I hope it was a fruitful discussion. We actually discussed more the types of questions in my group, not necessarily always related to Fit Flu. And the other thing that came up was that I just wanted to mention in debriefing from this is thinking about sometimes your process evaluation questions, are the things that a lot of people are interested in terms of everything related to delivery. So our group talked about technical assistance too. And then a question came around the timing or time frame for short-term and midterm evaluation. And I mentioned in my group that for our logic models, we really didn't give any guideposts for that, just because programs are of varying length. And so, a short-term evaluation for like a 2-month program could be different from a year-long or 6-month type program, and midterm evaluation, of course, would be months or a year after that. So you kind of have to know the length of your program in terms of timing of the indicators for short-term and long-term. So hopefully that just gave you a little bit of a chance to kind of work through the different types of process and outcome evaluation. And I'm going to keep moving on to our next step, which is gather credible evidence. So after we design our process and outcome evaluation questions, we actually want to collect the data. And I really like the way that we frame this presentation because it's really trying to get you to think about what's the most important thing that you want to find out. So for each of your evaluation question, before jumping to, I want to do a survey or other things, we have put into the pathway that you want to consider what are the most important indicator that you need to have to answer that evaluation question. And then brainstorm with your evaluation team, what are the methods to best collect those data? Again, thinking about accuracy, burden, and those types of things that we often think about in evaluation. And then also consider the measures. Do you have them in place, or actually do you need to develop them? So let me give you an example of an indicator. So an indicator is what is the completeness of the FIT-FLU program. And so if we want to understand that better, we actually need to have an idea of this actual ratio, the people who actually return the FIT kit over those who actually receive the FIT kit from your program at the FIT-FLU clinic. And so you would actually have to have some good data tracking to be able to do this, whether it's in Excel or in your EMR system, if you're doing this program. So this is a question we have: what proportion of patients who receive the FIT kits are using the FIT kits and actually returning them per instruction? So I have another example of an indicator question there that you can think about. For this question, what are barriers for patients in completing and returning the FIT kit? Could somebody put in the chat what might be an indicator or that they have for this, and then perhaps how you can collect that? This is a common question that we have in terms of implementing our programs, is addressing barriers, because we actually know that addressing barriers actually helps with behavior or environmental change. Okay, a barrier might be understanding how to complete the kit. Yes. So you might be getting information from them. So you guys are actually giving me potential barriers that they could mention. Yes. Language instructions are not as clear, even if you give them instructions. And of course, literacy. Those are all examples of answers that you will get to this. But an indicator might be, the barriers given by patients through a phone call, for example, where you're collecting that information from them. So all great examples of things that we might hear as potential barriers. Other indicators that you might want to apply are from other dissemination and implementation research models. And so I just wanted to talk about two of them: Proctor's Implementation Outcomes Framework and the REM Framework. Not going to spend a lot of time on both, but you probably have heard of one or any of these if you have been in the evaluation or implementation science space. So our next poll question is, have you heard of either one or both of these frameworks or none of them? Give you a moment. So we see that REM is winning out. I'm going to give you another few seconds. We're almost a third way there. Great, this is very helpful. So the final results are about almost 80% of you, the majority of you have heard about the REM framework, so I won't go over that in too much detail. Less of you, 20% of you have heard about Proctor's Implementation Evaluation Framework. And some of you have applied other frameworks as well. So thank you so much for doing that poll. So let's just get into these frameworks. Less of you know about this Proctor's Implementation Outcomes Framework. The citation is at the bottom if you want to look at it. But in terms of implementing evidence-based practice, the implementation frameworks are in this next middle box that she and her colleagues have suggested that you might want to measure. So they start with adoption all the way through sustainability. And of course, other outcomes that we might have are client, meaning patient-related outcomes, and also our system or implementation outcomes. So let's talk about some of those outcomes that she talked about. I put brief definitions of implementation outcomes here. These are other things that you can measure as some of your process outcomes. So you can measure, we talked about this before, acceptability from your participants of your program, but also from the deliverers, feasibility of whether the intervention can actually be delivered, appropriateness relates to people's understanding of does the program fit? Is it relevant for them? Would they suggest changes? Costs is what do they think are the resources needed to implement the program, and are there adequate resources to actually implement the program? Adoption are things around the decision-making process. What helped the implementers and or your program participants? Why were they interested in the program? Why did they sign up? That's what we want to know. Penetrance is a part of reach. It's trying to get at number of reach from your total population. So if you're doing screening, it might be, number of people who are age or gender eligible in your population, and you would have that underneath reach. Fidelity is something that we often want to know because we want to make sure that the program is implemented as outlined in an implementation manual or as prescribed. And of course, sustainability. So we actually talked about sustainability as a process indicator in our work group as well. The REM framework, as you know, is a implementation framework that looks at 5 different constructs. These are provided here in the middle: reach, effectiveness, adoption, implementation, and maintenance. This is a newer article that Russ Glasgow and colleagues actually posted about the REM framework. And you could see that they also have other things that you can measure related to REM. So if you're not familiar with this new article, you can also look here, but I'm not going to spend a lot of time on it since it seems many of you are familiar with it. And so here you can see a larger scale where they actually get you to think about measuring fit from all of the different strategies to intervention components with the context. And then you could also measure things related to reach, implementation, for example, adaptations and costs and the value of the intervention. So a little bit more detail about other areas that you can evaluate. This is an example of REAIM with the Fit Flu program, since that's the program we've been talking about. So here you can see some examples for reach, for example, the one that we gave from the indicators, number of people who are getting the fit kits who are showing up for their flu shot, all the way to implementation questions about how are they adhering to the implementation guidelines. So the Fit Flu program actually developed their own implementation checklist for clinics and pharmacies to actually go through and see if they're implementing all of the steps. So those are just some examples of REAIM applied to the Fit Flu program. So one of the considerations for gathering credible evidence is making sure that you can find the indicators that you need for the evaluation. So these are some of the considerations. Are these data already existing? For example, do you already have them in some database or your medical records? And if they are, you can make sure that they are part of the evaluation as the data source. If these data do not exist, you might have to develop your own mechanisms for collecting them. So that's where you might have on your team people who can develop database or people who can work with systems to add other indicators. Or you might actually have to look for existing data collection tools. So if you have a specific measure in mind, such as a measure of fidelity, you can see if the program developers have already developed a fidelity checklist, or if not, you could do a little bit of research on other fidelity checklists and then modify or create one that you can apply to your program. The other thing you want to think about is the logistics of your data collection. So you want to walk through a data collection workflow in terms of who will actually collect the data, when will they be collected, and how would they be collected. These are things that everybody thinks are top of mind, but not thinking through some of this for each of your evaluation question can lead to gaps in your data. So it's very important to kind of walk through that. So gathering credible evidence, you can look for existing data. These are some examples of where you can find data perhaps about your either short-term, medium-term, or long-term indicators. So maybe from your electronic health record in Epic, for example. You can look for your uniform data system data, if you're FQHC or community health centers, claims data, collect it from survey data on your own, or collect data that are collected from other entities, such as county health rankings or surveillance surveys from the CDC and other entities. You might even have to think about creating ways of collecting process evaluation data. So some example that we talked about is, do they actually complete the series of steps to get the fit tip done and mailed back in and getting their diagnostic? So these are some of the process indicators that you might have to collect. And then you're going to have to be able to track dates, numbers, who and percentages of distributing and to whom, so that you can actually look for stratified analyses. In terms of gathering credible evidence through surveys, you could do this in a variety of different ways. For collecting data on satisfaction, for instance, you can mail surveys. You could also email surveys to implementers, a clinic supervisor to assess if the new screening tests were actually implemented within your program. And for the outcome evaluation in terms of using surveys, you might want to consider what you need to get the most accurate or valid data. And so some of the challenges that we often have to overcome are that respondents may not interpret questions as intended, response rates may be low, and then we might not have the representation that we want. And so in your evaluation plan, you want to consider this. So for the first one, for example, we might want to do a pilot of any of our evaluation surveys. So we could flag questions that people might not understand, or getting them to do a think out loud process about what their understanding of the question is and how would they respond, to make sure that we get a sense of that. And then for representativeness, we might just want to consider, are there incentives for evaluation? Are there ways that we can make sure that we have ways to reach out to different population over a period of time to give them every opportunity to participate in the evaluation? So these, with each of the challenges that you might brainstorm, you might want to consider ways to overcome them with your team and have mechanisms in place. You could also gather credible evidence quantitatively, as we mentioned, but qualitative gives you an in-depth understanding of implementation. So one way to do this is by interviews. So you could have open-ended questions, and they're conducted either individually or in groups as a group discussion, or perhaps a focus group. So for instance, you can ask staff about, how was it to deliver the program? Did it go as well? You know, who was involved in the workflow? Who, you know, and what hiccups were there, or what challenges were encountered in the process? You can also use naturally occurring meetings in the blue that we have there. There might be staff meetings or quality improvement meetings that you can build upon to ask these questions, so that you don't have to create a whole new mechanism of getting data. The last method that we'll talk about is observation. And observation actually, I think, is underrated. It's where you actually can sit down and observe the activities and also the environment or context. You can develop a checklist or audit form so that the observer can make notes. And you could do this across a census, or more likely, we do a random sampling so that we can actually see how implementation goes. And for those of you who are familiar with QI methods, they're often process mapping and other types of methods that use observation a lot to understand implementation. And also to make changes in process. The last thing we're going to cover is evaluation plans. So evaluation plans take everything that we talked about today and put them in one document to kind of help you plan for your evaluation. From what are your evaluation aims, to what are the activities needed to collect the evaluation data for that evaluation question, the indicator, the person responsible for the evaluation, the data sources, and of course, when you want to collect those data. So this is an example, and we also included in your handouts a blank form that you can modify. But basically, for each evaluation questions, you could even subdivide this or create two tables, one for process indicators, which is what I typically do, and then one for outcome evaluation questions. And think through the indicators and methods. And this is a great thing to share with your team, and to make sure that you have ways to collect the data, and people responsible, and also a time frame for the evaluation. So the last step is to ensure use and shared lessons learned. I actually think this step also is a step that sometimes is overlooked, because we spend so much time in planning and collecting the data that we often also think about ensuring use just with a small number of people. So this evaluation step helps you to think about what did you learn so that you can modify or make refinements to your program, your evidence-based interventions. What are some of the advantages and the benefits that you found from your program? What were some of the challenges? And so I think one of the underlying things that we do is often share our evaluation results with our team, but we don't reach out to all stakeholders to be able to share the data. And some of you may have been able to start thinking about that. So being able to create reports, infographics, executive summaries are just examples of other kind of evaluation forms that you could share with stakeholders so that they can see what you learned from the evaluation process, and for also helping us to interpret the data and make decisions on changes to the program or to keep the program as is. So hopefully you have learned from today a variety of different evaluation kind of steps and processes. Some of the things that we mentioned is evaluation planning should begin from the very beginning of thinking about your evidence-based intervention, using it, and working with stakeholders to be able to consider evaluation from the start in your implementation planning process. It's always important to engage stakeholders. We don't want to have the step that I just mentioned where you're presenting data to stakeholders and they're like, what about this question, where you didn't have a chance to ask them before. And it may be some great data that you may have needed to collect, but weren't able because you didn't engage some people from the get-go. And you also want to make sure that you think about feasible ways of collecting the data without burdening all of the different people who might be giving you the data, whether they're archival records all the way to participants or implementers. We want to make sure that we not only consider outcome evaluation questions, but make sure that we have process indicators, particularly for evidence-based interventions that are often just adopted by new communities or being replicated if you're or programs that might be adapted, as we talked about. You want to make sure that you think about were they appropriate for the community and your implementers, what were the costs, as well as, you know, the client or patient or community level outcomes that you have. And the final thing, as we talked about with an evaluation plan and the template that we gave you, is creating an evaluation plan and walking through all of the different components is a great way to ensure that you would have all the data to have a robust process and outcome evaluation. So this is a reminder that we'll send out the evaluation survey to you, and you can click on the link. And also another reminder, we want to thank you for, if you attended all 6 of our sessions, thank you very much for attending. If you haven't been able to attend all of the sessions, we will be creating a new update to our CPCRN training website that will have all of these recording slides and handouts. You already have the slides and handouts for the sessions that you attended, but we will also have, I would say, edited recordings of all of these in case you want to hear them again. So be on the lookout for that in the next couple of months. So I wanted to stop it right now to see if there are any other questions